Well, if you think about it, microbes and microorganisms don't recognize borders, as we've seen with this pandemic that we're going through, this viral pandemic. So when we think of solutions to tackle the threat of antimicrobial resistance, we have to have a global approach, and we have to have a vision for a global perspective on how we can manage this problem, but also on understanding where the concerns are greatest, where the burden of disease is greatest, and where resources are least available. Because unless we are able to address and manage antimicrobial resistance in those settings, we will not be able to address it anywhere. So I think it's about working towards more equitable solutions that can be implemented in different healthcare settings, in different socioeconomic populations, and in diverse populations. That is why it's important. Another reason is that often we focus on the needs and practices and behaviors of healthcare professionals who are medically trained. And what we don't appreciate is that there are lots of different healthcare professionals who have a role to play in infection management and antimicrobial stewardship. This includes nurses, it includes pharmacists and allied healthcare professionals. And so for those reasons, it's really important that we have a perspective that is inclusive of the different cadre of healthcare professionals who are involved, and also patients and the public and their roles in antibiotic stewardship. We developed a massive open online course before the pandemic to share some of the methodology that we are using in our work on trying to understand the socioeconomic and sociocultural drivers for antibiotic use and implementation of antimicrobial stewardship in different healthcare settings. And we got together our faculty of international experts and researchers from around the world to contribute to this. And we had a very positive uptake of this course. We've had over 3,000 learners from 140 countries that have participated. And we felt the discourse that was being generated between our learners and our faculty around the challenges being faced warranted to be investigated and to be shared, because people were giving us lots of first-hand account challenges that they face, where they are in implementing antibiotic stewardship. And so we gathered this dialogue that was happening between ourselves and our learners on the course over the different iterations of the course that we ran. And it was really insightful into understanding what challenges are being sort of faced in different settings, and how it gives us a better insight into what policies need to be targeted in those different settings. So some of them are unsurprising. Just as I mentioned, of course, one of the challenges was different healthcare professionals, for example, nurses and pharmacists, telling us that although they had responsibilities for ensuring optimized use of antibiotics, they were often left out. So in many cultures, it's still very much medically driven decision-making in hospital setting. And that's something that we want to be able to challenge through good example, lead by example. In the UK, in America, in some countries in Europe, pharmacists and nurses are increasingly being involved in antimicrobial stewardship interventions. And this is something that we want to champion and really shed a light on the potential of those healthcare professional groups, the important roles that they have to play in this. Secondly, it was around the lack of access to resources, education and training. So even those individuals who have a role in antibiotic stewardship often are not provided with any training themselves and are left to improvise or to sort of get on with the job, as it were, without being given proper training. So that's something that needs to be addressed. Another theme that emerged across the different countries and different parts of the world was around the lack of engagement with patients, citizens and the public around the challenges of using antibiotics appropriately, around access to antibiotics, and really engaging with the users, the end user of healthcare services and antibiotics, to educate and have a dialogue with them about the threat of this slower pandemic, because antimicrobial resistance is also a is manifesting itself as a pandemic, but it's longer burning, slower, which is why we're not giving it as much attention as we are to the COVID-19 pandemic. So it's about learning from other campaigns in the public health domain, for example, the climate change drive that is happening around the world, to understand how we can galvanize and build interest amongst patients and the public for optimizing antibiotic use. And part of it is relevant because in many parts of the world, people have direct access to medicines without necessarily having to go to a healthcare professional. And so we want to make sure that the demand for antibiotics is always matched with need for them. I think unless we live in a world where everybody has access to minimum, an accepted standard of minimum healthcare and universal health coverage, it's very difficult for us to be able to remove the commodity that is antibiotics from populations. You know, one of the things that we argue about is reducing antibiotic use, which of course is not completely appropriate, because what we want is to optimize antibiotic use. We want to make sure that those who need antibiotics get them and get the right antibiotics, the right dose and at the right time. What happens often in low resource settings is that many large portions of the population don't have access to adequate healthcare, and this puts them at greater risk of ill health, greater risk of missing out on vaccinations, which are really critical to preventing infectious diseases. And it also puts them at greater risk of being exposed to infectious diseases through poverty, through lack of sanitation and hygiene standards. And for all of these reasons, it's really important for us to have a One Health approach and understand the socioeconomic drivers for disease within populations and across regions of the world that need to be addressed as the bigger picture of what is going on with this emergence of spread of antimicrobial resistance. I have to be very careful how we talk about this. We're not shifting the blame to countries that have less resources. What we're advocating for is that we need greater equity in the availability of resources between high and low and middle income countries when it comes to healthcare, when it comes to initiatives and interventions to tackle antimicrobial resistance. And that is a challenge that is very difficult to tackle, but is something that we need to always be working towards, is greater equity in access to resources, access to funding, access to effective medicines and healthcare across different regions of the world, so that everybody can benefit from the advances that we are making in medicine and science. I think it all comes back to equity, and I keep talking about this, but we need to build partnerships in research and in healthcare that are equitable. We need to support and share knowledge amongst ourselves and with each other in different parts of the world in an equitable way. We need to support colleagues around the world to be able to own and generate their own scientific research and knowledge. And this means that the funding available for research in antimicrobial stewardship needs to be more equitably used and spread, so that those in different countries, possibly with less experience in the models of research that we have developed through the funding that is always coming from the global north, are able to also contribute and participate equitably in research opportunities around antibiotic resistance. And this is really important because we need contextually driven and appropriate research and interventions, and that can only be done by individuals who live in those countries and understand, and experts. There's a lot of expertise in different parts of the world that is not being used to its full potential when it comes to research in any field, and as well as in infectious diseases. So what we can do as individuals is build bridges and work together in a more equitable way. I believe in academic allyship is really important, and that is about supporting each other in research and in collaboration to ensure that we can transfer the knowledge and training and learning around this field of research that we're involved with equitably, and that we support our colleagues wherever they are in the world to make sure that we are all working to the same standards of research. And this then can manifest itself in building capacity in different regions locally for individuals to be able to contribute within their field of expertise in their own setting, to be able to make long-lasting change and improve outcomes. And also, I think what we need to do as healthcare professionals is be much more proactive at working with policymakers, because a lot of the work we do is attached to funding. We need to have funding to conduct research that is then implemented and for long-lasting change is translated into policy decisions that lead to better health for everyone. And for that, as researchers, we need to work much more closely with policymakers and understand the political, the economic, and the cultural power with that is influencing work that we're doing. I think this goes back to work that I've been doing over the last 10 years, and this study is an example of it. Really is about the fact that no matter where we are in the world, we face our own challenges when it comes to trying to implement effective antimicrobial stewardship interventions. We all have our own resource limitations, and I've worked with colleagues in Norway, which has a very advanced, very affluent healthcare system, and with colleagues in other parts of the world, and we all have challenges, but it's about developing contextually fit interventions that make the most use of existing resources and innovation that is already in practice. And that comes from working locally, building capacity locally, generating knowledge that is locally owned and locally used. So I think it's about making sure that we collaborate with each other around the world on this issue. We learn from each other, and that we support each other in being able to implement interventions that are going to be long-lasting.